Here's something that might shock you. That tiny metal mesh sitting in your artery right now didn't even exist 40 years ago. I'm Dr. Mitchell, and if you've got a stent, or you're about to get one, what I'm going to tell you today could literally save your life. Pour yourself some coffee and get comfortable because we need to talk. Before that stent went in, something was seriously wrong. Your arteries were clogging up, plaque building layer by layer like rust in an old pipe. Picture your blood vessels as highways carrying oxygen to your organs. As that plaque piles up, the highway narrows. When it hits 70% blockage, you start feeling it. Chest pain when you climb stairs, when you exercise, when your heart demands more blood than that choked artery can deliver. If you got your stent before a heart attack, count yourself lucky. But here's what happens when luck runs out. That plaque ruptures, a blood clot slams the door shut, and your artery closes completely. Now you're in a race against time. You've got 8 to 12 hours before those heart muscle cells start dying permanently. Dead cells don't come back. They turn into scar tissue, weak spots, sometimes aneurysms. If they got that stent in you within 4 to 6 hours of when the pain started, they saved the maximum amount of muscle. Your heart gets to keep beating strong, and you get to keep living fully. The first stent ever placed in a human heart was in 1983. France, 2 doctors named Poul and Sigwart. That primitive device looks nothing like what's inside you now. In just 40 years, stents have transformed from simple metal scaffolds into sophisticated bioimplants. Modern stents are coated with a special polymer that releases a medication, a cytostatic drug that keeps your artery cells from growing too aggressively over the mesh. See, early stents had a serious problem, especially in diabetics. The body would overreact, cells would pile on top of the metal, and the whole thing would clog up again. We called it restenosis. That polymer coating solved it. The drug seeps out slowly, steadily, keeping the healing process controlled. It's engineering that borders on miraculous. In the United States, coronary stenting became standard practice in the early 90s. I'm literally about the same age as my own specialty. Think about that. 40 years ago, if you had a heart attack, you just laid there. We'd start an IV, give you heparin, maybe try clot-busting drugs if you were lucky. If you survived, you'd face open heart surgery, chest cracked open, hooked up to a heart-lung machine while surgeons grafted new vessels around the blockage. These days, we rarely do that anymore. Maybe 1 in every 150 patients needs bypass surgery, and only when the anatomy is too complex for a stent. But if you're having a heart attack, the interventional cardiologist is going to fight with everything they've got to open that artery back up from the inside. It's truly miraculous. Now here's the part that's going to keep you alive, and it's wildly misunderstood. Dual antiplatelet therapy. You've been prescribed 2 medications. First is aspirin, 75 to 100 milligrams, the baby aspirin or enteric-coated kind. Second is either clopidogrel, which you might know as Plavix, or ticagrelor, known as Brilinta. These 2 drugs are what allow your stent to work. When that metal first goes in, your body sees it as a foreign invader. Your blood wants to do what it's designed to do: form a clot and wall it off. These medications stop that reaction cold, giving the stent time to become part of you. Over the next 12 months, your own cells gradually grow over the stent. Every gap in the mesh gets covered with new endothelium, your own natural artery lining. The stent integrates. It becomes you. After a year, you can usually stop one of the medications or step down to just aspirin. But until then, especially those first 3 to 6 months, you cannot miss a single dose. Not one day. Plan ahead. Refill your prescription before you run out. Most insurance covers these. If you're struggling with cost, ask your doctor's office or the hospital social worker about patient assistance programs. They exist, and they'll help you. Because here's the brutal truth. If you skip even one day, you risk stent thrombosis. That means a blood clot forms on the stent, and you're right back where you started. Or worse, another heart attack. Or if you didn't have one the first time, now you will. These two medications work like two locks on a door. If one fails, the other holds. But miss your doses? Both locks open. Your only job here is simple. Take the pills. Let me address something patients worry about constantly. They think the stent might move or shift. They're terrified of getting bumped or jostled. Let me put that fear to rest. When a stent is deployed properly, it's pressed firmly into the vessel wall under high pressure. We use intravascular ultrasound to measure the exact diameter of your artery and match the stent perfectly to that size. It's locked in. It's not going anywhere. Ever. Here's something interesting. The stents we place in coronary arteries can technically be compressed. I'm going to show you one right now, and you'll see exactly what I mean. But understand this. Nobody's reaching into your chest to crush it. In real life, it's safe. Now, stents placed in other arteries like the carotid or the iliac, those are made to be completely crush-proof. Those areas move and flex, so the stents are engineered differently. Let me show you the difference. In my hands, right? Now is a coronary stent on its delivery system. This is what goes inside your artery. See this tiny mesh collapsed on a balloon? It's made from a hypotube, a miniature tube etched by laser with a pattern that, when expanded, gives maximum strength with minimum metal. I'm connecting the inflation device now. This gauge measures up to 30 atmospheres of pressure. We usually deploy stents between 10 and 16 atmospheres. First, I pull a vacuum to clear any air. Now watch. I'm starting to inflate. 4 atmospheres. See the stent beginning to open? This one's 3.2 millimeters in diameter. Pretty standard size. Now we're up to 14, 16 atmospheres. Perfect deployment pressure. The balloon is fully inflated. Every cell of the stent is open. Now I deflate. And this is what it looks like after implantation. Once we pull the balloon out of the artery. The balloon's completely deflated now, and I'm gently withdrawing it. This beautiful little device saves lives. I promised I'd show you how it can be crushed. But remember, in your heart, this will never happen. It has radial strength up to a point. See? I'm squeezing it. Even with the natural contraction of your heart muscle, even if the artery runs right through contracting tissue, nothing happens. It's engineered for that. But if I really force it, yes, it compresses. That's exactly why we don't use coronary stents in locations where they could be crushed. In those spots, we use crush-proof designs. This thin, elegant little spring saves thousands of people every single day. And coating it is that polymer substance containing the drug that prevents new plaque and controls cell growth. It's beautiful. I know this is overwhelming. Medication names, timelines, dosages, lifestyle changes. You've got to take statins to lower the cholesterol that caused your plaque. You need to control your blood sugar if diabetes played a role. You must quit smoking, one of the biggest triggers for plaque formation. You have to monitor your blood pressure, another major predictor of atherosclerosis and future blockages. But here's the thing. Life doesn't end with a stent. It continues, often better than before. People who suffered crushing chest pain for years suddenly start living again after stent placement. You can exercise. You should exercise. If you didn't have a heart attack, if it was just unstable angina or a close call, you could even run half marathons after recovery. A stent isn't a limitation. It's a bridge to a new life. 30 years ago, this option didn't exist. Without it, many stories would have ended tragically. So let's be grateful for these little springs that preserve not just life, but quality of life, health, and the simple gift of being here. Subscribe to the channel and take care of yourselves. I'll see you in the next video.